Good. Good morning, all. My name is Chris Bolways. I'm the mayor here in the city of Elizabeth, and I'd like to first of all welcome all of our high school students who are getting out of class to come hear a very important message from Governor Phil Murphy and Congressman Albio Series and some other representatives here in the state of New Jersey. So the best part of it is you get out of school, right? You know? You're really here to learn? Okay. The governor's thrilled that you're here. I want to recognize members of the city council that are here and members of our Board of Education that are here as well, members of the Union County Freeholder Board, Library Board trustees that are here, and I want to thank all of you for taking the time out of your schedule to join us here today. We're here to talk about Get Covered New Jersey and the Affordable Care Act and the 2019 enrollment period. And just a couple of things that we've done in the city of Elizabeth. We've raised awareness, we've discussed plan options, we've worked with residents to complete the Affordable Care Act applications, and our city's Department of Health and Human Services have worked with 1,000 people in a one-on-one situation to get them enrolled. We've attended the Union County Affordable Care Act. That's important. I want to thank LaGreta and the members of the Health Department who have worked really hard on all of that. Stan Neron's here, a member of the Board of Education and the Assistant Director in that department. Sessions were held in City Hall, our senior centers, local churches, nonprofit organizations, media platforms. We did training and marketing and enrollment fairs. We made their skills better, learned about chart changes, and as well as availability and the healthcare options through CMS training sessions at the Kane University STEM building. Getting the word out on healthcare is why we're here today. That's why Governor Phil Murphy has chosen the city of Elizabeth to be a part of his efforts between now and December 15th to get as many people as possible to enroll in healthcare. I'd like now to introduce a member of Make the Road New Jersey, Ms. Crease, who's been very active in working with people to get them signed up for the Affordable Care Act. Crease?
Good morning, everyone. My name is Crisia Flores, and I live here in Elizabeth. It's such an honor to be here. Thank you, Governor Murphy, for being here with us. And thank you for the Public Library of Elizabeth for hosting us. Health insurance is such as the most important part in our lives. I know this because after 10 years, I was without medical insurance until the ACA was a law. For years, I went without having an annual checkup because I was so worried about the medical bills, about going for an emergency to a hospital because I couldn't afford those bills. But now we have the opportunity to go. I have the opportunity to go for those annual checkups. Thank you for this ACA. I have a daughter who is 22 years old, and I work for a child care. That means that it's not just important, this insurance, health insurance is not just important just for me. It's important because I have to take care of my family. Governor Murphy has stood up to protect our health care and keep it affordable against threats by the Congress and the Trump administration. Because of that, our health insurance rates here in New Jersey are some of the most affordable in this country. Now we have to do our part. We have to sign up for health insurance like I did. It's easy and very simple. You can visit getcovered.nj.gov and find out how it works for you, okay, and get options that are the best for you and your family. It takes just a few minutes to get enrolled, and the open enrollment is until December 15th. And we are just less than 12 days less to get covered. So hurry up, okay? And don't spend more time, right? And please think about your own health and the health of your family. You can apply, as I said, to visit the website getcovered.nj.gov, or you can go to the social media or call 1-800-318-2596 to apply on the phone. Thank you so much.
Wow. So impressive. Great job.
I'd now like to introduce the person who has really gone through the state of New Jersey and has worked really hard in making sure that people in New Jersey can get covered. All of the young people that are here today, one of the great things about the Affordable Care Act is you can get to stay on your parents' health insurance plans to the age of 26. So if your parents are not involved in health care, you can take this message back to your parents that Governor Phil Murphy is going to deliver now. The governor of the state of New Jersey, Mr. Phil Murphy.
Thank you, Chris. Thanks, buddy. I appreciate that. Thank you, Mayor Bowledge. More on you in a minute, but thank you so much for those kind words and for hosting us today. And reiterate my welcome to the Elizabeth Public Library. We're not in libraries enough these days to the young folks here, so it's great to be with you today. This is one of dozens of locations, I might add, across our state where residents can simply walk in and walk out enrolled in health care for 2019. So that's one of the many reasons why we're here today. Christia, thank you so much for those extraordinarily compelling words, for sharing your story. It is for residents like you that we are all here today. So thank you for all that you do. Again, Chris, thank you for your leadership of this extraordinary community. I was here the day before the election. It was a successful one, I might add, as well. So, Mayor, to you and your extraordinary council, Board of Education, the folks who make this great community go, every day I take my hat off to you. There are many, there are many elected officials here, but I also want to single out two great Union County freeholders, Bruce Bergen and Angela Garreton. So it's an honor to have each of you with us here today as well, folks. Also a pleasure to be with this extraordinary lineup to my right. So we've got, beginning on the far right, Marlene Caride, who we will hear from in a few minutes, our Commissioner of the Department of Banking and Insurance. We have Carol Johnson, who's a Commissioner of Human Services, who does an extraordinary job. Carol, honored to have you with us. Our Treasurer, Liz Moyo. Madam Treasurer, great to have you folks to be here. And we will also hear from Phyllis Salo-Kay, who is the heart and soul of New Jersey Citizen Action, in a few moments. I'm also incredibly honored to be joined by an old friend, the guy on my far left, your far right, Congressman Albio Ciras. Thank you, Congressman, for your commitment to this community, to the district, to the state. So, to each and every one of you, honored to be here. So this is crunch time. There's no other way to put it. The Affordable Care Act enrollment period ends next Saturday, so that's a week from Saturday, December 15 at midnight. That's 12 days. And by the way, these are not the 12 days of Christmas. These are the 12 days of health care. If you need health care for the coming year, now is the time to act. Now is the time to visit. As Christia said, getcovered.nj.gov. Again, getcovered.nj.gov to start the process of getting enrolled. And it's not a hard process. We've seen the reports that across the country, this is quite troubling, although I have to say I'm not terribly surprised given leadership in Washington, that ACA enrollments are down from this point last year. Again, that reality, by the way, isn't really, based on what we could tell, any different here in New Jersey. And that makes it even more vital to push over these next 12 days to reach everyone who needs health care and to get them enrolled. I think historical habits of enrollment would suggest the last 12 days are the most propitious, the ones that we're not here by accident. The end of an enrollment period tends to be where you get the most amount of folks lining up. There could be any number of reasons why the numbers are down, but we're not going to take a break or make excuses when we still have 12 days to go. And we're going to keep working hard, as we are today, to get the word out. We have a great story to tell in New Jersey, and that story has made us the model in many respects as it relates to health care in the era of Donald Trump for the entire nation. We're proving that when you stand up for the principles of the Affordable Care Act, you end up with more affordable health care. Because of the efforts we put forward throughout the year in partnership with the legislature, and I want to thank them for that, next year's ACA plan rates are actually on average more than 9% lower than what consumers are paying this year. And many families will qualify for assistance to lower their costs even more. Now, for some perspective, had we done nothing, healthcare consumers in the individual market would have seen their rates increase by 12.6% from last year. So our rates are coming down 9.3%. That's about, for you math majors, that's about a 22% swing with what we will have versus what we would have had we done nothing. And that's a big deal. That's about $1,500 on average for a family in this state. But these savings don't exist unless you enroll, and that's the key point today. Enrollment again ends at midnight next Saturday, December 15. In partnership with nonprofit and community-based groups across the state, we have been a full partner in this year's enrollment efforts. Any New Jersey resident who needs health care can simply go to one website, as I mentioned already, getcovered.nj.gov, getcovered.nj.gov, to find out everything they need about available health care plans and their rates. You can sign up online, or you can find the closest location of a walk-in registration place, just like this one, near you, where trained volunteers can guide you through the process and into a plan that works for you and your family. And a reminder that individuals who can afford to get a health care plan but don't enroll themselves or their families in a plan will have to make a shared responsibility payment when they file their taxes next year. Our insurance marketplace works better and at a lower cost for us all when everyone has health care or pays their fair share if they don't. But again, I cannot stress this enough. Time is of the essence. The window for 2019 closes in just 12 days. We want to make sure that every New Jerseyan has the health care they need, and we've already done so much to make sure it's at a price that they can afford. Again, so here's my pitch. If you need health care, go to getcovered.nj.gov. Learn what's available to you and your family, and enroll either online or at a location just like this one that's closest to you. My hat is off. Our hats in government are off to all the volunteer groups that have been so important leading up to this enrollment period and now during the enrollment period, including Make the Road New Jersey, where Chrissia represents so strongly, Phyllis's New Jersey Citizen Action, who have given their time, whether here or at other sites across the state, to help make sure our fellow residents are enrolled. I also want to give a shout out to New Jersey Policy Perspective, the New Jersey Healthcare Quality Institute, the New Jersey Hospital Association, and the Primary Care Association for their advocacy for the reforms that are having such a positive impact. Before I hand the podium over to my dear friend, Congressman Albiosiris, I wanted to say something off topic, and that is with the nation, and I know everybody up here with me, we mourn the loss of President George H.W. Bush. In my personal lens, this is a guy who was as responsible for the fall of the Berlin Wall and the reunification of Germany as any American. And I had the honor of serving as the U.S. ambassador there, got to know the president. He was an American hero. God bless him and God bless his family. With that, I hand things over to an extraordinary public servant in his own right, Congressman Albiosiris.
Well, good morning, everyone. First of all, let me just say, Mayor Bowich, thank you very much for having this place for us so we can push and make sure that people get covered. But I just want to say something about Mayor Bowich. This is not the first time he's done it. Right from the beginning, he's been ahead of the curve in trying to get people in the city and in the state covered. So, Mayor, my hand is up to you. Governor, what can I say? You're all over the state. This is a great thing we're doing for the people of New Jersey. You're going to many different places, working for different groups to make sure people are get covered. And you are our messengers. We have to December 15th to get people covered. And I want to say thank you to the people, the volunteers that are promoting this. You know, the Republicans voted 67 times to kill health care. They have cut the navigators. The navigators are the people that help people when you call to get insurance by 84% up to 2016. In this past year, they cut it 35%. So they never expected that the volunteers that are here in this room and throughout the state have gotten people to register because this is so important. In New Jersey, it's extremely important. We have gained almost 400,000 people to get health coverage. And it's no longer a pre-existing condition as an excuse. You can get covered up to your 26 years old, your son. So you, when you go home today, tell your parents, you are our messengers. This is very, very important. And the best thing that's going to happen now, coming in the next year, is that the Republicans won't be able to vote against our health care 67 times because we have taken the majority. It will never come up again, thanks to you. You know, just in my district alone, the 8th district, the health coverage, people did not have coverage for about 25% of the people. It has dropped down to 17%. And that is with all the efforts of the Republicans in trying to kill this act. Can you imagine how they worked along with us? How many people be covered today? So look, you got 12 days left. It is extremely important that you go out and tell your parents. And again, thank for all the people that are volunteering to get people covered. We are fighting the good fight. We've been fighting the good fight for many years because health insurance is important to everyone in this nation. So I thank the elected officials that are here. I thank all the volunteers to get this message out. Governor, thank you again. Mayor Bowich, I can't say enough about your efforts over the years on this to get people covered. So we will do our part to continue to provide to you the best health care we can. And I thank you again for being here this morning. Thank you.
Well said, and I think it's you made a point, Albio, that's important to underscore. Notwithstanding all the assault and attack on the Affordable Care Act over the past couple of years under this president, Republican leadership in Congress, with a Democratic House of Representatives, God willing, we could take a break from that and find ways to build it back up again. Amen. It's made a huge difference in this state. Millions of folks with pre-existing conditions. Albio and the mayor, Chris Bowledge, said that there are youth that can stay on plans, their parents' plans until the age of 26.
By the way, women used to be charged 47% more. No
Yep,
longer.
No longer the case. Here, here, here. So there are lots of seniors unfettered access to prescriptions and drugs that they need, unfettered access to a whole range of things. Employment, by the way, thousands and thousands of folks employed. With that, representing our cabinet today, I'm honored to welcome up somebody who's been right in the middle of the struggle, not only to preserve health care and expand it to as many as possible in this state, but also at the right price. And you heard me talk earlier that it's going to be a significantly lower price in the year 2019, and no one is more responsible than that than our Commissioner of Banking Insurance, Marlene Caride. Marlene?
Good morning, everyone. Come on, high schoolers, you can do better than that. Thank you. Good morning. Governor Murphy, my fellow colleagues from the cabinet, Congress and Mayor, and everyone here. Thank you. As has been said here, the Trump administration has continuously worked to dismantle the ACA and to destabilize the insurance market. But under our leadership of Governor Murphy, we are leading the nation in combating those efforts. We have implemented policies to better ensure residents have access to quality, affordable health care coverage. And because of those actions, plan rates are down 9.3% on average in the individual market for 2019. Now, I'm going to repeat myself because it's worth repeating, and it's repeating also what Governor Murphy had said. Plan rates in the state of New Jersey actually went down this year. Now, we knew heading into the open enrollment period, we were facing challenges due to the federal government's continuous sabotage. That included federal funding cuts. New Jersey lost more than $1.5 million in funding for navigators over the last 2 years, and you all heard from our congressman. Advertisement dollars nationwide were slashed 90%. So that is $100 million to just $10 million for all of the states of this wonderful country. And open enrollment was cut from 3 months to just 6 weeks. Now, we know that this is a challenge, but we are not discouraged. Despite the challenges, the state is working to ensure that as many residents as possible get covered, and we've seen what the mayor has done here in Elizabeth. We launched the Get Covered New Jersey last month, the state's first coordinated public awareness campaign to promote the open enrollment period since the implementation of the ACA in 2014. Through these efforts, state departments, agencies, along with community organizations are working to ensure that our consumers know their coverage options. More than 50,000 people have visited our website over the last month. On the website, residents can find information for coverage on and off the marketplace, as well as information for New Jersey Family Care. They can also find information on the availability of financial assistance, also where to get help in their community, and the bottom line is to get enrolled. We've also launched an advertising campaign that includes billboards, transit ads, digital ads in English and in Spanish to get the word out, particularly in areas where the uninsurance rate is high in the state. The Department of Human Services provided grants to community organizations to support enrollment efforts, improving the state's on-the-ground efforts to get residents enrolled. With less than 2 weeks of open enrollment, we are making a final push here in New Jersey to get covered. We are urging residents to visit our website, getcovered.nj.gov, in order to review their plan options, determine if they qualify for financial assistance, and most importantly, to get covered. I really want to emphasize that many people qualify for financial help. Last year, 8 in 10 people purchasing on the marketplace received tax credit to help them pay for their health plans. Some people even qualify for no-cost coverage, and there are plans that are available for less than $100 a month. There really is no excuse. We want people to know that there's not much time left and that the deadline to enroll is December 15th. It is extremely important that residents realize that in New Jersey, there is a requirement to have health care coverage. The alternative is that unless you qualify for an exemption, you will pay a penalty at tax time. So please do not delay. If you need coverage, go to our website. If you already have coverage, speak to your family and your friends and remind them that the deadline is December 15th. Make sure that they know and that they understand that beginning January 1st, there is a requirement in New Jersey to have coverage. If you miss the deadline to enroll and you do not fall under one of the exceptions, you will pay a monetary penalty at tax time. As for the organizations and for the public officials who are supporting the effort, thank you wholeheartedly. We ask that you keep up the momentum for the next 2 weeks. Let's get our residents the information that they need, and let's get New Jersey covered. Thank you.
Thank you, Marlene. And I mentioned she was, Marlene, speaking today on behalf of our cabinet, and other than by myself, on behalf of our government. But to Commissioner Johnson, the Secretary, Treasurer Moyo, and Commissioner Caride, three extraordinary professionals, three areas of government that are right in the middle of what we're talking about today. And I'd say more broadly representing the whole of government approach that we've taken to the Affordable Care Act, in particular to the enrollment aspects of it that we're referring to today. So to each of you, I say thank you. And Marlene, thank you for speaking for the group. I mentioned there are some groups that have been laying it out on a volunteer basis, not just in the past month, but ever since I signed Executive Order number 4, I believe, in the first days of our administration, which basically said we're going to open up the megaphone on enrollment for the Affordable Care Act, and none more so than New Jersey Citizen Action. And it's my honor to ask its leader in heart and soul to come up and say a few words, Phyllis Salo-Kay.
It's really great to be here in a library. I was a teacher in Newark for 10 years in my other life, and we were always in libraries. Now, not so much. This is the 6th year that Citizen Action has partnered with this Elizabeth Library, thanks to Andrew Luck, who's the assistant director. We are working with Make the Road to do outreach in Elizabeth and in 5 other library locations in Passaic and Union County. There are several things people need to just remember. It doesn't cost anything to shop around for your product. In fact, many plans are more affordable this year, as you heard, than last year. Number 2, financial assistance is available to help bring down the cost. 8 out of 10 people who enrolled last year received financial assistance. Number 3, people can enroll by phone, in person, online, at offices like Citizen Actions, which is in Newark on Halsey Street, open 6 days a week. We are not going to allow the sabotage that has been done by this administration to undermine the ACA. For the first time, we have a governor and an administration and a cabinet that are fully on board helping people to promote and defend the ACA. And a Congress, I'm so sorry. And elected officials, I apologize. So we thank you all, and if you're already enrolled, find 3 other people who aren't enrolled and get them to sign up. Thank you.
I know Phyllis well enough, but by the way, I met Phyllis in a diner where I've met most outstanding people in the state, and I know one thing, don't cross Phyllis. So getcovered.nj.gov, do not pass go, do not collect $200, get right there immediately. A particular shout out, we'll take a few questions here if we have a minute, Mayor, is that okay? A particular shout out to the students with us today. So what a treat to have you with us. This is Carol Johnson and I were having a conversation offline, things like pre-existing conditions, other things we're talking about. These are issues that we're going to be dealing with in our state for the entirety of your lifetime and your kids and your grandkids. And so the fact that you're paying attention to this important topic while you're young and in great health, with great spirit here today, it means a lot and it says a lot. So hats off to you. I've been drawn to that Boston Red Sox hat over there, but I'm not going to make I'm not making a comment on that at the moment. But I'm with you. Bless you. Oh, geez, so don't, please, we can't refer to this stuff. We're in Elizabeth, New Jersey. We have to keep this to ourselves. From the press, please. Any quick questions? Michael.
Governor, just to clarify what Congressman Siri said, did you say, Albio, that New Jersey has gained 400,000 new people with health insurance since the ACA came into effect? Okay, that's...
I think, is that our number? That's about it.
390.
Yeah.
390.
Yep.
98, 99.
Big numbers. Come on, Carol Johnson's going to jump in.
Our total number is 800,000, 550,000 of whom we've covered through the Medicaid expansion, and the rest we've covered through the marketplace. 800,000.
But Albio's breaking it in two, right?
Yeah.
To
From 2010 to 2016, 398,000.
Yep.
Okay.
So you got half basically through Medicaid expansion and half through the individual market. Please. Yeah, although it will depend on what it is, and I'll let you know.
What do you envision your role or your job being when you become the head of the Democratic Governors Association?
I'll explain later what I meant. It depends on what it is. There's a good reason for that. So I was elected as the vice chair on Saturday and the chair-elect in 2020. We don't exist on an island in New Jersey. We exist as one of 50 American states. And I spend most of my time trying to find great ideas that have been either promulgated in our own past, and there are many, coming up from whole cloth today, great public policy with our team and teams around the state, institutions of higher education, but also with a window into what else is going on around the country. And I have found the Democratic Governors Association a particularly helpful organization to do just that. So I'm proud to be associated with it. And I'll preempt perhaps a second question. I'll do it my own way, which means I'll do overwhelmingly most of it from right here in New Jersey, because that's job number one for me, period, full stop, and it always will be. Well, in an organization like that, you've got some amount of policy, you've got some amount of working with candidates and finding great candidates. You've got some amount of raising the funds to support elections. There are 3 governor's races in 2019. There are 11 plus 2 territories in 2020, and so those are elections that I'm honored. I would also add, the more evidence and data points of good governance at the state level, because I think you can make a strong argument that governors have never mattered more, given what's happening in Washington, the better that is, not just for those places, but that reflects back as well to a better, stronger New Jersey. Please.
Yeah, you said earlier, enrollment's not quite where you'd like it to be.
Yes.
Are there any plans to unlock or allocate additional resources to the outreach effort?
Well, I was back and forth last night trying to find creative ways with our team, which wouldn't necessarily relate to unlocking more resources, but finding other avenues through which we could pound the table. For instance, I had talked to Kathleen and Deb Kornavaca about faith leaders, about community activists who could help us spread the message. So that's not necessarily a funding item, but it is perhaps a channel that we could run through more deeply. So I think we'll continue to think through. Again, time is of the essence. When you've only got 12 days to work with, you got to be nimble, and that's what we will be. Please, welcome back, Dustin.
Did senior aides or anybody close to you talk to legislators about restricting or skipping the legislative inquiries coming up?
That's one I'd love to talk to you about. I'll come back and talk to you about it back there. Is that okay? Particularly, I want to respect the students who are here today. Please, anybody else?
Have you read the use of force report that we put out last week?
I'm not. Our office is going through it. I've got a general sense of it, but I'll defer on that if I could. Please.
As far as the open enrollment, forgive me if you said this earlier. I know you said it's down nationally, year to date compared to last year.
Yep.
New Jersey-wise, do you have some numbers?
Do we have the numbers? They are in New Jersey. They're down 16 point. Yep. About plus or minus down 16%, but that is versus a snapshot in time, as we were discussing earlier. And the last days in all these enrollment periods, there is a rush to the finish line.
And Governor, that's just the marketplace.
That's just the marketplace. So that's, we're here today because we want to fill up the last 12 days as much as we can.
I'm sorry, down 16% from year to, or at the end of the open enrollment period, or down this time?
Point to point. Point to point. Again, I want to thank Mayor Bolwich, to your extraordinary council are going to come on up here, I think, and join us. Congressman, Chrisia, thank you so much. Phyllis, for all your work. To Liz, Carol, and Marlene, and to everybody associated with the library. Again, getcovered.nj.gov, and most importantly, to our extraordinary students here today, thank you all very much.
You too. Councilman Frank Cuesta.